Hi friends, most of you are allergic to bleeding and seeing blood, right? And especially consider if the blood is oozing out from your mouth or seeing blood-stained cottons from your mouth. That is more really terrifying. But unfortunately in dentistry, most of the procedures involve some amount of blood. So is there any alternative to this procedures which involve bleeding? Yes, there is. Lasers. So I'm not going to explain about the basics of lasers or how it works, but in dentistry, when lasers are used to do a minor surgical procedure or something like that, there is completely no blood, no pain, no post-operative discomfort. The only problem with the use of a laser is that during the procedure there will be a slight burning smell, and that burning smell is also sucked aside by the dental chair. So what are the procedures which can be done by a laser? First is a frenectomy. So what is a frenum? A frenum is nothing but a muscle fiber which extends from the upper lip into the jaw between the front two teeth. So what the frenum does is that it prevents the upper teeth from closing. If you notice some of the kids, they will have a small space between the upper front teeth, and this frenum will be very prominent. So this frenum has to be removed before the eruption of the permanent canines. So before the eruption of the permanent canines means it should be removed before 10 years or sometimes even 6-7 years. So consider subjecting a 6-7-year-old kid to this type of treatment with a surgical procedure, and this kid will have sutures in place, will have swelling for 1 week, he cannot talk, he cannot eat. But in lasers, this is just a 5-minute procedure, and after the 5 minutes, the kid can just go out and have his favorite food. So the next procedure which can be done is a laser assisted new attachment procedure. This is nothing but an alternative to the gum flap surgery. So the flap surgery which is done for gums, the gums are opened up, it is cleaned inside and then it is closed, sutures are placed, there is a lot of bleeding. But in lasers, these lasers are used to clean the areas of the gum and it results in a good gingival health. The next treatment procedure is an uppercolectomy. So uppercolectomy is nothing but a removal of small soft tissue in the third molar region. Most of the third molars, while erupting, they will have a soft tissue covering which will be very painful. There will be accumulation of food, there will be accumulation of pus. So this soft tissue can be removed very easily with a laser. And then a crown lengthening procedure for neat, and gingivectomy for making the gum line very neat and very contoured. This procedure can also be done with a laser. And after ulcers, some people or most of the people would have experienced stress ulcers in the mouth. This stress ulcers usually they heal with some vitamin supplements and some oral gels, but for some persons these stress ulcers do not heal at all and they are very painful. So these stress ulcers, these can be treated with lasers, but it has to be done for at least 3 sittings so that this laser helps in healing of the after ulcers. Next, some small benign lesions, non-cancerous lesions. For example, some children will have some small tumors or some amount of cyst in the lips or tongue, etc. So this tumor removal or cyst removal will involve a lot of blood, whereas if it is done with the help of lasers, this results in a faster healing and no bleeding at all. So I hope this video was useful to you. If you like this video, please subscribe to our YouTube channel for more dental videos. And if you have any doubts, you can post it in the comment section below. And also you can WhatsApp me in the number 90952 80903. Thank you.